Well, hello there. Welcome to Women Around a Table Eating Food. We're Nick and Jen, therapist and writer, partners in crime, and lifelong best friends. Around here, WTF means what the food. And it's our excuse to go deep, get real, and share the kind of messy conversations that usually stay between us and a plate of something delicious. So sit back, grab a bite, and join our conversation. Hey girl, hey.
Hey girl, hey, hey, hey,
Hey.
hey, hey. And I'm gonna just repeat what I said earlier. I really do. I have not gotten used to I haven't gotten used to this new haircut. And for all of our listeners who haven't tuned in, or maybe you're just tuning in now, Nick shaved her head to celebrate her 50th oh, wait a minute. Oh, does your mom know? Has she seen it yet? The
No,
face that you just
but she
the
doesn't
face
listen to, I know she doesn't listen
Well,
to
you know
most of
what's funny? My mother doesn't either. Can I just say that? So I would just like to say thank you so much to the women and men out there who do listen to us on the regular. And because honestly, our mothers are not among you. And I would have
Yes.
thought, for all of the concerts and the shows and the acapellas, this is and the goodness, I mean, for going to Rosecliff, she and
Hmm.
Daddy went to take pictures when we were getting ready. I feel like this is a moment in my life and your life for us to be doing this. And
Hmm.
you know, Heidi and Tisha, get on get on the pod train for God's sakes. We
Get on
got
the
some good
pot.
shit going on. I mean, granted, I know that you don't really approve of the overt cursing, and hopefully at this point you've kind of just gotten used to it to a certain
Yeah.
extent. But so let's just go
I
back.
think my mom would love the cursing. I'm just not so sure she would love it or do.
But she's so if anybody's just listening to us and not watching, Nick shaved her head. Nick
Yeah.
has one of the most beautiful shaped heads in headdom, and she looks and I'm telling you, and I was telling this to her earlier, that now I kind of forget that she's done it. I forget that you've done it, and then I
Yeah.
see you and it's just and your makeup and just your face and your like everything about it, it's so striking on you. Not every
Mm,
woman could be able,
thanks.
not every human could pull off that look, but you do, and it's just I wish I had the girl balls to do it. But can
Remember,
we go back? I know.
we did the mock-up. Okay, go ahead.
I loved it. I
I know, I
loved
love
it.
that.
My fam was not. Now, my mother has no idea. She hasn't seen that mock-up at
At
all.
all.
And I don't know
Okay.
that I've shown her I don't know that I've shown her your pretty mug. But yeah, my family, it was one of these like, oh, that's nice, but you're not going to do it, right?
Yeah. Hmm. I
But
know.
I don't know. I can't even imagine how freeing it must be. It's
Oh, it's
just
so great. We were out on a walk today, Heather and I, this morning, and she's like, "Do you think I can salvage my hair? Because, like when you have curly hair, long hair, like you have, like you don't wash it every day because you don't want to strip the oils out."
sure.
And she was like, can I get away with not washing it? I was like, I don't know. Like you might need a little spray or whatever. And then I was like, do you think I could get away without washing my hair today?
And she's like, bitch, no. I mean,
Yeah.
yes. I mean, wait a minute, you have no hair. Yeah.
Yeah. It's fun.
Yeah, that is fun. Well, and she doesn't wear hats all that often, but fucking that's what
Mm.
hats are for. That's what hats are
Yeah,
for.
exactly.
And clips. And now
Yeah.
I mean, I've got to I need to make an appointment with Jason. I had an appointment and then I had to postpone it. But now all I'm doing with this is like I've got enough clips like I can get it up, I can do, but it's just sort of she's all over the place right now, and
Mm.
I think I want it short again
I love
because
that.
this sort of feels like I'm I don't know. I feel like I'm trying too hard to make it look good on there. Well, not today,
Mm.
obviously. Today was curly hair, don't care, but it's a little difficult to
Your hair always looks
manage.
good.
Oh,
It
you are
all,
so nice.
oh my God, no,
Dude,
you've got the best hair.
you're so kind.
Mm. I just love you.
Mm, I love you too. Our amazing guest is going to be here in 3 minutes, so I feel like I
Hmm.
don't have enough time to dig into this. But my I just need to tell you that my unbelievably amazing husband surprised me for an early birthday present last night and took me for Gen ticket seating to see Nate Bargatze at the Amica
Stop.
Center in Providence. And it
Stop.
was outrageous. And I just need to shout out to my phenomenal husband for who also said to me, we were talking about how the seats that he got were just so good. And it's antithetical. It's Dr.
Hello,
Kumar.
ladies. How are you?
We're
Oh
so
my
happy to
goodness.
see you. Oh my
Oh my
gosh,
God.
you luminous
You,
thing.
oh, this is called this cool light that I got. Look at this. Yeah, see, it
Oh,
attaches to the back
Oh,
top and it filters
yeah.
your whole face.
I
you do look
I love
soft.
that.
You look sort of lit from within,
Yeah,
definitely.
yeah, thank you. It's not food that I ate. It's not exercise. It's a light.
You know
Keep
what? Girls got to do
keeping
what
it
girls got to
real.
do.
Yeah, you got to
That's
keep it
okay.
real.
And for the five people who watch us on the U of Tube, like
Yeah.
everyone else is just going to listen to us describe how luminous you look. But yeah,
Uh,
everyone, that's a good plug for whatever light that is. Not a ring light because it was square that you
no,
just
no,
showed us.
I actually saw it on a 19-year-old TikToker. It's like Logitech. It's a Logitech
Oh,
light.
all
Yeah,
right.
she was filming
Oh.
herself talk about vibe coding. I'm like, wow, this girl's crazy intelligent.
Mm.
And then I want her light. That's what I came away with. Forget about vibe coding. I'm too old to learn that.
You are not. You know
Oh
what? You're
my
32
goodness.
years old. You can do anything.
There you go.
Exactly.
So we're
Awesome. How
so
are you?
happy to have you, and thank you for being willing to do this. And it's quite early where you are.
No, our day starts early. I have like three young kids who are out in bed by like 5:45.
Wow. Okay. All right. So, you're not just like helping all the women across the world, you're also taking care of your kids.
Yeah, they're adding
Sure.
people to the world as well.
Yeah,
Yeah.
exactly. Adding craziness. That's what it is. Chaos.
Yeah. Yeah. So, I would love to just like introduce you as our guest right now. And then we've got so many things to ask you and talk about, and we're super excited. So,
Awesome.
um,
I'm excited too.
yeah, so for our dear listeners, today we are joined by Dr. Diana Kumar, who's a board certified OBGYN, a menopause specialist, engineer turned hormone translator, and the kind of doctor who actually explains what the hell is happening in our bodies. Before medicine, she worked as an industrial engineer, which maybe explains why she approaches women's health like a system that deserves better
Mm.
data, better answers, and way less gaslighting. After years of seeing women dismissed and rushed through appointments or told their symptoms were just a part of aging, she helped create a new model of care, one centered on listening, evidence-based treatment, and access to expert menopause support, no matter where you live, as the co-founder of Gliss Wellness. And so we're going to talk about why menopause care is still failing for many women, what women should know about hormones and midlife health, and how to advocate for yourself. And side note, she's Jen and my doctor for our menopause journeys. And so welcome and thank you for being here.
Oh, thanks so much for having me. It's going to be so fun.
And
Yeah.
and
And
and I'll add our requisite kind of inside joke. Gliss Wellness, not a sponsor, not opposed, FYI, not opposed. We love the idea of being able to partner with people who are doing things that matter. And Nick, that was a beautiful introduction, by the way. You did a beautiful job.
Thank you.
Well
Hey,
Yeah.
done, you.
thanks. Yeah, it's funny because the how I actually found you originally, Dr. Kumar, is I was starting my whole perimenopause journey and things like that, and I was noticing my skin was doing funny things, and so like I got some face cream from Alloy Health, and you were the prescribing physician on that, and I was like, huh, okay, well I need more, and so then I stalked you online, like I found you. And then I found Bliss Wellness and I said, oh my God, like there's somebody who provides comprehensive menopause care at that's accessible. And so thank you for creating Bliss Wellness.
Yeah.
Oh, thank you. It's our little baby. Dr. Walsh and myself, we were just one day sat on a plane to Paris and decided, what can we do better? And that's how it came
Mm.
about.
Mm.
Had the two of you worked side by side previously?
Yeah, so we worked at Kaiser for almost 7 to 8 years. We were both operated together.
Wow.
So we were co-surgeons for a long time. And then for my 40th birthday, we decided to go to Paris together with a bunch of other girls. And
Mm,
then we created this thing called the burn book, which I feel like every female should have, is books that
mm,
you agree with your BFF that you're going to burn it in case I die. No one can ever see this book
mm.
because it has ideas of like mild craziness, what I would do in my life if I had enough time, the things that you dream about. And then we started saying, hey, we've got similar dreams here. We have similar goals. What can we do to make this come alive? And we did it.
Wow.
That
I
just
love
brought
that.
tears to my eyes when you just said that. It like harkens back to all of our 11, 12, 13-year-old selves if we kept a journal or wrote the things, and yeah, it's just for you, but how beautifully special to be able to actually, it never even occurred to me to have something like that connective in writing with somebody else like that. That's beautiful.
Isn't that great? Oh, I also call it the burn book because people say journaling is like a positive thing, right? There's these journals that say name the three things that you want to happen today or positive, but sometimes we have mad thoughts, things that you're like,
Yes.
that's what the burn book is also
Yeah.
including, right? It's all the cool, positive things, but it's also the things like, oh, I wish this, or
Hmm.
these are things that people would never allow you to think, but it's in our head. You write it
Yeah.
down, and
Who
then
you'd
it
like to
can
throat punch that day, perhaps, maybe. Road rage
yes.
moments. I mean,
Road rage,
it
right,
happens.
right. My husband chewing is driving me insane, and I just don't understand. Like,
Yes, yes.
why is this teeth so big?
And
Oh, that's so funny.
these things come up way more often during perimenopause, by the way. Somebody breathing funny in the corner, it's like, oh my God.
I know. It's just how it is. And then I have two boys, so sometimes I do something, and I'm like, is this the next generation I'm raising? I must fix this. But it's pretty normal for them to smell like a gym locker
Gypsies.
24/7.
Yes.
Yes, yes, yes.
I have a
Um,
dear friend who's a wonderful dad, and every now and then when I just kind of complain about something, he'll just say, "Honey, you just got to remember, like all children are gypsies at some point. They just are." And it's like, yeah, yeah, I suppose you're right. I suppose you're
Uh,
right. And because we were too, because
hmm I
we
bet.
went through our own flavor or scent of gypsiness when we were younger and the things that we threw at our folks knowingly or unknowingly. So, we're
Right.
just they're paying it forward or we're
Yeah.
paying it backward or whatever it is.
At
How old
least
are
my
your
little
kids?
girl, they are, let's see, I was good, 7, 10, and 12.
Mm,
And I have a girl in the middle. And
mm.
she always recognizes it. She's like, oh, you know what? I think I need to go brush my teeth. My sons are like, it's been 2 days. Good luck. You know, it's gonna
oh
be
my
Oh,
okay.
goodness.
that's too funny. That's too funny.
So I would love to just know, Dr. Kumar, just how did you find yourself like in this field, like perimenopause, menopause support? Like what were you seeing where you're like, okay, this is where I need to be?
That's a rough, like long transition too, because when you come out of residency, I came into OB just fascinated by women and giving birth. It was
Mm,
something I was fascinated when I was a teenager and then in my 20s, and then you spend all of residency like perfecting it. It's not ever perfect, but you get better at it, you get better at counseling patients, you can become a mom yourself. And then the middle part of my career, I spent a lot of time operating.
mm,
We did minimally invasive surgery, and this repeated thing after I operated on them or after I took care of them was something's wrong. I'm gaining all this weight. I'm having
mm,
hot flashes, and you would do these loud, and you're like, nothing's wrong with you. I was one of those who blew them off because
mm,
I was rushed. I had to. My whole day was filled with surgery, and I think that if I did surgery, it's an engineering thought too. Like I could fix them. It's a surgeon
Mm,
mentality, right? If I just operate, this is the quick way to fix them. It's an easy answer, or it's. And I should take that back. It's not really an easy answer, but it's a treatment that it has something to quantify or qualify and say, okay, I've treated your endometriosis, I've treated your giant fibroid that's causing heavy bleeding, but the repeated answer is always the same, especially in the 40s. Even for women I've been
mm,
seeing decades, I don't feel the normal in my body. and maybe it's lifestyle, run more, eat less. Are you sure you see your dietitian? And then at some point, you can only repeat it so many times and you're like, wait, this is not solving the problem at
Yeah.
all. I've been saying this for 5 years straight. I've said the things that I was trained to say, and then now I'm entering it myself. And they're right, but I don't know how to fix this. And all doctors feel really like anxious or unsettled when we can't fix something. And it may not, menopause is over time, I've learned that it's not something that we fix. It's just a natural transition. What can we do to make women go through this journey better, easier, feeling more like themselves, maybe, and also making them go into the other side and feeling like this is going to be the best decades of their life. And then that's when we really enter to say, we need to better educate ourselves what's out there.
I heard a quote recently. Martin Short, the actor Martin Short, was on NPR. There's a new documentary out on Netflix that's about his life, and I didn't realize that he had experienced such profound loss as a young child, with many members of his immediate family who had passed away in close succession. And unfortunately, his daughter took her life earlier this year, and she had mental illness. And the interviewer, his name is A. Martinez, was talking with Martin about about grief, and just talking about moving past the grief, and I'm just going to paraphrase it, but I thought it was really beautiful. It was an acknowledgement that you don't ever that type of grief and the loss of a child or the loss of someone, it's not anything that you have any intention of getting over. You just learn a new way to live with it. And I don't know why that reframe at 7:10 in the morning just sounded so beautiful, but it feels like it echoes what you just said about menopause and perimenopause. It's just, okay, like, this is a fact of life. This is something that happens to everybody. We can either go into this good night just guns ablazing, or gently, or we all have a choice, right, of
Mm-hmm.
how we're going to approach it. Sticking our heads in the sand doesn't help, but just
Mm-hmm.
embracing it and figuring out what the best path is for us feels like it is more of an acceptance and an understanding and a walking with it, rather than trying to beat it into submission and get
Right.
over it. I loved that you said that.
Yeah. Yeah. What, so, I've heard this too, because I've immersed myself in a lot of the the literature and a lot of all of the kind of perimenopause, menopause conversation that has really risen to the surface, I think, in the last
Mm-hmm.
5 or so years.
Yes.
Why do you think that it's kind of getting the attention now?
Women are louder
Mm,
than ever before.
Mm,
They need to be, right? In the current political climate and then the movements over the last decades have been, hey, we've got to be louder, not only about just the workplace life, our life, but our health. We
mm,
always took a back burner to it. My mom, for example, she's the typical immigrant Asian mom who really never complained about anything. She did her
mhm,
two jobs, raised her kids, and then an Asian population, which is predominantly who I see here in Hawaii, we don't, suffering is not something that was cool to talk about. You just swept it
mm.
under the rug and continued on. So now the culture has changed, both as the generation and as across, I mean, ethnicities, in marriages too. The man, when he has erectile dysfunction, in a decade he created new drugs, made it legal, make it easy and accessible,
Mm.
flip a switch, and here we are still fighting for testosterone. I
Yeah.
get pushback every single day. So I think, hopefully over time it will even get better. But I think that's the big reason, our volume.
yeah.
Mm.
Yeah, I've met so many. I've met a lot of women lately who are finding their voice in it and learning to advocate, with their doctors and things like that. And what I'm so surprised at, though, too, is what that there still are doctors and providers that are saying, like, but they're not trained in this. Like, you spend
Yeah.
Yeah.
how much of your medical training was actually focused on this phase of life for women?
I'd say the majority is almost near zero. So that is the sad part. And that's not an effect of us because I went through residency and at that time my attendings were already in the group that didn't see HRT because it really canceled itself in the early 2000s. You know, they did that WHI study that really had a lot of statistical bias, just shown a really the wrong light on the wrong age. And then the New York Times sent out that article in the early 2000s and canceled HRT across the US, across the world. And
Mm.
that silenced it for decades. And so every physician who came out of training did not get any training for, that's what, 2 decades. And
Mm.
until now, only is it being taught again in residency. So you're going to be another 2 decades for that next generation to come out and really be doing HRT as a norm. And I speak for them because I really feel they are working all the other OBGYNs, and I say others, not the ones who are not doing menopause care and telemedicine, they're holding the fort down because as they know, they get paid less, they're getting hit across the political environment is not great right now for birth control for all the other decades behind us. So they are seeing 40 patients a day because our system is broken. They don't have the time to sit down and read and listen to 4 different podcasts and catch up. They can only keep up with what they know is the majority of their practice, whether that's obstetrics or gynecology. So I feel a mix of it. I think Teresa and I were joking, like it took us a year where we were working our job and adding in 40-hour work weeks to build Gliss, but also get educated for it. So we were burning 100 hours a week for almost a year to get it up to like we learned how to legally send medications across state lines. We had to learn what states could and couldn't do testosterone. We had to learn about how to use testosterone correctly, and we got pushback too. I prescribed testosterone in a state I had a DEA license for, which is like this license you need to have a controlled substance. And the pharmacist would call me and say, I can't fill this. And I'm like, why? It's written exactly the way I'm supposed to write it. And it's because I had to learn all these things. Like you're writing it because we don't do gender affirming care. And I'm like, it's not gender affirming care in this state. And so it's those things that
Oh,
another physician wouldn't have time. They'd be like, I give up.
yeah.
So
Right,
I can't blame
right.
them, you know?
Yeah. Wow. That's amazing. Thank you for doing all that.
I know. And I'm thinking about I've never actually thought about this from a medical profession perspective, but I went to graduate school for journalism, and I've always spoken about how I feel like graduate programs don't do the best job at teaching you how to create the business of the work that you're going to do. Like you learn your craft, but you don't
Mm-hmm.
necessarily learn how to become a consultant and how wonderful it would be if there was sort of a business 101 for this is how you become an LLC, or maybe you want to be an S corp or and what you're describing, I mean, it's heavy enough to go through medical school. It's heavy enough to be able to do all the things that you had to learn how to do practically. But then to add the business building aspect and the fact that you needed to replicate that in 50 states, many of which did not have the same rules and regulations, it really is it really is remarkable that anybody would choose to do some type of a virtual practice knowing how much more work and effort it takes, right?
I know. Well, I tell you, is there's many things you, as you know, as their own. If you're saying the LLC and S corp, you've built these businesses, and I know Nicole, you have too. How
Mhm.
it's like a climbing a mountain, and I also feel like it's not well accepted for women to do it too. When we were
Yeah.
starting, I know we were talking to an accountant. We had to go find a consult, and they're like, "You want to do what? Why? Women don't want to buy that." I'm like, "It's not about buying it. It's like access. Like, can you help us do it?" And it's like, well, and it's begrudgingly. You're not
Yeah,
going to be successful at it. So it was many other things. It wasn't just those voices sometimes get very loud when you're trying to build a business
sure.
because you believe in yourself, but you also like, well, is what they're saying true that this is going to be impossible? Oh my gosh, I had a lot of that.
More
Wow.
and more, I think it's important for women to be in these industries so that we can support one another. Because when
Yes.
you get faced with sort of that, I don't mean to typecast, but that elder male energy that it is that why do you want to do this? And you think for a moment, you're like, my money is just as good as the next person's
Yes.
money, and my ideas are just as like, just because I have breasts and a uterus, why should that like preclude me from having a business brain,
I
And if
know.
I'm going to pay you to do this and I want to do this, let's just do this. It's
Yes, I know.
yeah. Yeah, that's a near and dear issue to me. I hear that. Uh, I would love to ask you because of the nature of our because of the nature of the name of our show is Women Around a Table Eating Food. I would love for you to talk a little bit about some of the things that you see or things that you recommend women be aware of as they approach these ages and maybe start realizing, I always used to be able to eat this thing, and now I don't feel like I can. Or even Nick and I have discussed how a lot of her symptoms manifested in different ways than mine did. And you and I have talked about, you were sharing with me a lot of the allergies that can come on once somebody is a certain age. Talk about the diet and the nutrition and the like pulling your hair outness, or what are you seeing? What do you wish women knew about what happens at this time in life with their diets that may have been great all along and then all of a sudden start confounding them?
Yeah, that's a big one. It's so hard because I think one, you said so many things, and I thought, oh, you know what? It's giving up the wine. We tolerate our alcohol so much differently when we age.
Totally.
That's the one thing that I hear about the most. Like, I used to be able to drink 2 glasses of wine after dinner, and I would, hang out with the girls on the cul-de-sac. And now I drink 1 glass of wine and I'm wrecked for 2 days. Like, what
Mm,
is wrong with me? So it's not giving up things. I always have to tell women it's not giving up things. It's just changing that you can't have 2 glasses, but it might be that a one and a half or a half a glass, and understanding this is now going to be a future change. Like, I can't
mm.
change that, right? HRT is not going to be able to give you the 2 glasses of wine back, but that's what they're
Damn.
always hoping.
Oh,
You
That's
said that, I
funny.
thought, what is the thing that's most important to it? Wine. That's what it is.
Hmm.
But what we eat, it does affect us differently. It's stored even differently as we age. It's stored in our stomach areas. It's stored in the axillary areas in our low back, where people are like, oh my gosh, I've never gained weight like this before. And it doesn't matter if I just do a fad diet. I used to be able to lose that 5, 10 pounds easily in, a month. And now it's been 6 years and I'm still getting like
Oh,
pounded. So it's a hard thing to say. Is you have to work so much harder now in your 40s and
yeah.
your 50s to lose the weight or maintain than you did. It's a change in everything. It's like an aging thing. It's a metabolism thing. It's the way we process our carbs and our fats. So I used to say, and look at my 30-year-old self when I was an early physician, say what goes in, calories in, calories out. That was one thing I said, you should just exercise more, see your physical trainer, work with nutritionists. How many times? I'd say 90% of them, by the time they come see me, have already done those things,
Mm,
and it's not working. So I think it's a mix of things, because it's the way we work out. You can't just go and say, oh, I used to be a marathon runner. I ran all the time, and now my body composition is changing. Then I usually say it's a muscle mass thing too. You can't just run anymore. You have to add on muscle mass, because you're losing it. And if you don't have muscles, then you lose your balance, you lose your strength, and therefore you lose your energy, you feel more tired, and you run less, you
mm.
exercise less. It's like a cycle. So I think of it, like you said, I think of it in an organized fashion. We go for the diet, small changes make a big wins, change the activity level in a different way. Where if you're walking 10,000 steps a day, that was great if that was the first step, but it's not, you can't just do that by itself anymore. And then the third is how we eat, the times we eat. I have a lot of patients who did intermittent fasting throughout their 20s and 30s. It starts to falter and fail in your 40s and 50s. You
Yeah.
can't work out fasting anymore. There's great podcasts about that. And wine, alcohol intake, caffeine intake, it all starts to change, because if you're taking too much caffeine throughout the day, you're not sleeping, you're
Yeah.
going to gain weight. So it's multifactorial, multifaceted on how we approach it. and for that. But eating, when it goes down to the diet, I don't think people should give up anything. Everything in moderation for sure. Because what's the joy in life if the last decade you give up all carbs?
Yeah.
Yeah.
You'll be thinner, but I don't know if that's the thin me that I would
Yeah.
want.
Yeah.
Or if you're gonna have the home baked sugar thing, or you're gonna have the glass of wine or have the thing, change, like you said, how much and when. Like
Yeah.
nightcap, not a great idea, but
Yeah.
maybe, or the
When you're
sweet
cooking your
thing.
pasta. Yeah.
Yeah,
Yeah.
absolutely. If it's going to be wholesome and homemade and delicious, have it once a month. Or I think your moderation piece is enormous. And also thinking about the fact that so many people go to these delicious things in times of stress and in times of agitation and consternation, that the hardest thing to do is to find moderation when you're feeling like you are amped up to the
Mhm.
nth degree all the time too. And I
Yep.
know that Nick has found that in her practice, right? Like you've
Mhm.
seen just changes in people's fortitude, attitudes, the things that they're willing to do, the things that they're not willing to do as they age as well. So I feel
Mhm.
like the things that both of you do so go hand in hand with the
Mhm.
mental strength and the physical strength, both of them being
Mhm.
so necessary.
Well,
Yeah.
Jen, you brought up a good point because Nick, you're right. In mental health, that's where you're hitting it the hardest. Because I think the mental health, we forget about it. I
Mhm.
just literally went through the physical and the diet, and the mental health so heavily influences all those others: sleep, diet, and exercise. If you are not feeling great, you are not going to do any of those three things.
Yeah.
Yeah.
And that's hard to recognize first. And my approach is all these other things, but sometimes the mental health is the hardest to treat in my clinic. It's hard to do that via telehealth. It's also hard to
Yes.
change our life in one appointment. And women get frustrated. They're already frustrated when they come see me and they're like, oh, you want me to do another three? It's a lot of hard work. You want me to do hard work, maybe 3 to 6
Mhm.
months to work on my mental health and then come back? And I'm like,
Yeah.
well, okay, you're right. We're gonna do this. There's my side, and then there's all these other sides. But it's hard for women to swallow that.
Yeah. Yeah. No, you're so right. And it's interesting because right now what I see a lot of is the identity shift that happens for women and like during this phase of their life. And so there is such a mental health component along with all of the physical and biological symptoms that they're having. And so I think there's such a need for, as we continue like this perimenopause menopause conversation, to incorporate that mental health piece. Like that is such a critical component because it's that like I don't feel like myself type of thing.
Mhm.
And I think women are shedding old roles that they used to play in their
Yes.
families. They are stepping into an embodied, empowered form of themselves. It's so very nuanced. But it also makes me think a little bit too about how these symptoms, and we just talked a little bit, and I would love to hear more, like what are the main symptoms you're seeing in your practice for women on a physical level, but how that varies from person to person
Mm.
Oh
and
gosh.
based on race, based on socioeconomic status, because menopause for me is like a white woman is very different than menopause for a Black woman, for an Asian
Yes.
woman. I would love to hear your perspective on that.
That is a really good point. Every woman that sees me so different. If I put you all in a room and I were to put like a list up there and tack it on, many of the more common ones you'll see lots of little points on, like hot flashes, night sweats, and weight gain. Those are the three big ones. And hair and skin changes. So I would say those are
Mm,
the big four, and they're all not everybody has them at the same time. Some people are early 40s already feeling it, mid 40s, 50. There's a 54-year-old who's like, I had my first hot flash when I was 54. So,
oh,
and she's like thinking how unlucky she is. And I'm like, well, you should talk to the 40-year-old over here,
yeah.
So it's so different. And then And then you have your I say it non-classical, less common. So this is where the part where they feel like they're not validated and going insane because no one else feels it the same way. Somebody mentioned to me, it's like their hair on the back of their neck drove them crazy. That's when they knew for 3 years they've been having this, and they said that they had cut their hair shorter, grew it out. It's just like anything touching their neck, breathing on their neck, a necklace on their neck just made them insane. And she's not the first one to say that. I see so many every single day that I can now connect the dots like, oh, you're like, I probably hear that twice a month. The burning tongue or food tasting differently. They thought it was a COVID thing because I was like, my tongue now, I just don't feel like I taste food the same way. But I felt that years before I got COVID, and I don't understand what that is. Ringing in the ears. I've heard the itchy ear. Somebody had actually flares of eczema, started at 42. Never had eczema in a day of her life. Never been allergic to any detergent. She eliminated everything and still was having that. And when she had come to see me, she already had other perimenopausal symptoms. So I thought, let's just try some HRT. And it's just an experiment with both her and myself, a learning thing along the curve that she was like, oh, my eczema completely resolved when I started HRT.
Wow.
I'm like, and I was on, oral steroids because it was really, really bad at one point. I was like, well, that is impressive. So I used that, data point. And if somebody else says that to me, I offer it if all things have failed. Because I do tell them to see their dermatologist first, because there's many other, sometimes it is the normal things before it's the abnormal things. But among ethnicity, that's a big one. So African Americans who come see us usually have had symptoms for way longer, sometimes earlier. And the studies even represent that their hot flashes, night sweats can be much more severe. They may need higher doses to alleviate them, and they can last up to a decade. So they go through 10, 12 years, and they're culturally, some of the older patients and I don't want to say what age is old, but they will suffer quietly for so many years because it's accepted. No one talks about hot flashes in the Black community. They're like, the ladies in churches never mentioned it. And I was like, well, you should go start talking about it, because I bet you they're all going to raise their hands. So you'll see that. I think Asians tend to have lighter symptoms compared to African Americans, and the dosage really affects them. Small changes make big changes, and they have side effects at lower doses. And that's all anecdotal. There's no official studies for that. It would take a lot, but predominantly I see that. They also see their symptoms are not always hot flashes. And they represent more wider things like hair loss and skin changes. Hispanic populations they present with hot flashes also, but they have a lot more vaginal atrophy, pain with intercourse, vaginal dryness, recurrent UTIs. And some of this is anecdotal, some of this is seen in studies again. But yeah. And then
So
of
this
course,
is
white
really
women have all of them.
right.
I see a lot more atopic diseases, so the autoimmune. The
I was
autoimmune
just going to
flares.
ask you about that. That is so crazy you said that. I was going to say, do you see so I had gotten I had a positive ANA test. So I delved a little further and got an even more comprehensive panel of autoimmune tests. And it came back that a lot of nobody's going to know what this means but you, but like my cardiolipin and like all of that
Yeah.
kind of stuff was super, super elevated. So I monitored it over the past year, and it has stayed elevated. So I finally went to a rheumatologist, and I'm not very symptomatic. Yeah, I have a little joint pain, but like I'm also lifting 250 pounds off the floor. So I'm going to have some joint pain, right?
Yeah.
I run, I do and things like that. And so I'm not very symptomatic, but I've got all these autoimmune kind of markers that are elevated. And so can you talk a little bit about what you see there with this our perimenopausal, menopausal age group?
The direct links is still kind of hazy. Those studies are years out because you need a lot of people, collect a big number of people to get all those autoimmune diseases, and then you can test within them. So that's the hard part. And the span is so big. You're talking about asthma or asthmatics getting worse. You're talking about eczema, lichen sclerosis, plainness, so vaginal diseases and oral diseases, and then you get your lupus, rheumatoid arthritis, the more common ones that people hear about. So the span is so big. And now inflammatory diseases are like, endometriosis can't be forgotten. There's a lot of thought that PCOS is linked to inflammation, which very likely is with all the cysts. So then you've got this huge panel, and they're more common, or they start to appear more commonly in the 30s, mid 30s, and then again in the 40s. So you've got this decade or 2 decades of time where they do fine, and then the flares start to show up, or their first presentation of all these diseases, and then it's a mystery because they're hard to diagnose. So for a decade, they're like, "What is it? What do I have? I have a rash that's on my face, it's on my cheeks, that comes and goes, and then now I have joint pain." So it's not a perfect thing where they check mark off the list and they say this is lupus, because it
Yeah.
presents in so many different ways. So they're hard to diagnose. They suffer for many, many, many years. And then when they're there, the treatments are not always great. Some things, the newer drugs are great, and then they sometimes get stuck with intermittent steroids. Sometimes it's really severe. And the first thing you don't think about, it's not always going to be perimenopause too.
Yeah.
So that's the hard part, is like, does HRT make these things better? And some of them, yes. And some of them, no. It has some other cause, but can we decrease the numbers of flares? Is it related to this? So that's going to be really hard to find out as time goes by. And I always say to women who go in this journey that it's going to be a journey of the two of us. And I don't have all the answers. But it's an experiment, because you have all these other symptoms, maybe perimenopausal, but actually maybe related to your disease. So
Yeah.
you need to see the rheumatologist, plus you need to see, maybe work together.
Yeah.
And then I should mention that these women have higher clot risk. So a lot of doctors are afraid to give them HRT. And that is the other piece of it. So they could be in their 40s having terrible flares. They're on steroids, and people get nervous because they might have other things like kidney disease, hypertension, and then they have a higher risk of blood clots. Cardiolipin is one of those labs, and they're like, "We can't give it to you." I'm like, "But
Yeah.
yes, you can." That
Yeah.
hasn't been, yeah. So
And I would have, and I'm so glad that I actually had worked with you first before going to the rheumatologist, because I know that, like, I know that my transdermal patch is not the level of increased clot risk as the oral, right? Like, so I
yes,
went in armed with information, and she was great. And she's like, honestly, you're not symptomatic. Well, I'm not going to give you any medicine, and you haven't had a miscarriage, you haven't thrown a clot, you've like nothing like that. And so basically what you are is you've got an undifferentiated connective tissue disease. That means, like, we can't figure really out what it is
yeah,
right now,
it is.
but we just monitor it, and and make sure that your symptoms don't increase.
I think that's the biggest thing too, is there are more of these doctors who are women, and
Yeah.
women around that age. Because I will tell you, there's many rheumatologists, and I'm not beating on men today, but I feel like I am. It says that the old man rheumatologist will usually take the patients off HRT sometimes, and I'm like, why
Yeah.
did you do that? She's been taking it for 4 years without issue.
Yeah.
So yeah.
Yeah.
I'm listening to you talk, Dr. Kumar, and you've got this, and I can say this personally, being a patient of yours and just having Nick describe working with you before I reached out to you. You have this way about you that's so clinical and assertive, but also so soft and so willing to listen. It's this lovely combination of left brain, right brain delivery that makes people feel so comfortable when they're sitting with you. And we have these virtual meetings, and you show up and you're looking right into Zoom, and you just, as a patient, you feel very seen by you.
Oh,
It
thank you.
Oh, you're so welcome. You're so deserving of that. I I'm wondering how much, we kind of going back to the mental health piece, how how cognizant how cognizant do you feel that you need to be about a bedside manner necessarily when you're dealing with women who are sort of at their wits' end? And do you feel like there needs to be a certain amount of helping to air traffic control the situation, bring people like down to, a more calm place? How much do you feel that you need to be kind of managing where they are in an appointment and trying to quell people's fears? And do you think that that's harder? Do you think that that's harder because of the clientele that you're dealing with right now? And do you feel like you have to work harder at it in order to kind of be more calm, be the peace that you want to see in the world almost?
I don't, 90% of my job is what you just said. The medicine part is easy because that's what I did for the last, several decades. So it's that what I think is going to help is the easy part. It's the other
Mm,
90% to say, I'm hearing you, that
yeah.
they have to feel heard because I think when they get to us, usually if they've seen other doctors already, they feel like it's everything has been brushed aside, that they are, and we've brought this up several times, they feel like they're not themselves or losing their minds. So a
Mm,
lot of it's just this vent that just comes
mm,
through and we let them have that. And that's the nice thing about telemedicine is that you have that time. Normally in your normal like PCP or GYN, this is not to blame the system is broken, but they only get 7 to 10 minutes with you. And we used to make that joke, we gotta go into a hole, the vagina, and come out and talk about your everything in 7.5 to 10 minutes. So we would talk while we do the exam and the breast exam. We are just like checking off as many things as we can. So the luxury of telemedicine is I'm not doing an exam, but we are just making sure that you are listing the symptoms that you are or that you're going through, or all the things, life stressors, and how can we approach that in a better way. But I also approach it as an engineer. I break it down in small pieces
mm,
because if you give too many things to do, I know all the things that someone needs to do or myself needs to do, but we have to break it down. I can't just say all at one time, you need to walk your 10,000 steps and eat this much protein and eat this much fiber. And by the way, you need to sleep 10 hours a night and you need to take your HRT. But those are the three things you need to take, plus your vitamin D3. These are the supplements. By the time I'm done, they're like, what?
yeah.
I just, so it's like taking in small little bites, the things that we can control. So that's 80% of the time. The other, and also the fear mongering from social media. I
Mm,
would say physicians across the US right now spend more than 80% of their time fighting the misinformation.
mm.
And so that's the other thing. Like I read somewhere that I need to eat 200 grams of protein, and I was like, "How's that working out for you?" She's like, I'm constipated, and I spend all day chugging protein, and I'm like, "Yeah, so let's reel it back because maybe like these are the things you really should eat, and then
Mm,
anything else is a positive, it's a plus." Because I do get that a lot, or I read that this is the one thing I used to not have to say is please don't put the patch on your face or your neck because they read that
Stop.
if they put, right, because estrogen was an
Yeah.
anti-aging thing. So if we put it on the lines of our neck because we're spending so much time reading social media, that if I put it there at night, it will make it better. I'm like, oh,
No.
I don't think that's how it works.
I remember you
That was,
said that. I remember you said that during our first when we were making the decision that I was going to go on the estradiol with the patch. You had said that as well, and you made a funny joke about it. Just like
yeah.
I have to say it. I have to say it. I need to
Because
say this.
you have to. Somebody asked me, so now I have to add it to my patient instructions. But that's like 5 minutes, where she's like, "Oh, so I can totally put two on my necklines," and I'm like, "Well, for what necklines? And two? No, don't do that."
Don't do that. Oh my
Well,
goodness.
I'd like to actually commend, and this might be a nice opportunity for you to explain a little bit about your model for folks who are listening to us and thinking, "Oh my gosh, like Gliss could be
Mhm.
bliss. This could be exactly what I need." You have clever things like healthy, which you use to be able to communicate or to book. And I would imagine that if you can't fit in all the things that you think or know during a session, you have the opportunity to be able to follow up with notes or just you make yourself available. Talk to everybody about what it's if when somebody goes on the Gliss website, what what is it like to book with you and what can they expect if they choose to go through their perimenopause or menopause journey with you?
Yeah. So our website is www.findgliss.com. And you go on, you can explore around, and then it's as easy as making a 15-minute free appointment, or if you're ready for it, you just make an appointment. And there's these forms that are filled out for you. The nice thing about it is we use Healthy, which is a medical record is HIPAA compliant. It protects everyone's privacy, and you can text or chat through it. And you can upload things like how many times you've been to the doctor and you wanted to talk about a post that you saw on social media or an
Totally.
article. So we do allow patients to, on their intake, to upload them because they're thinking about it right then and there on their computer. And so I have patients who said, I saw this post and this post at this post, or I read this article, and then we have the time to explain it and go over it. They can upload their labs because I have been guilty in the past where I order these labs and I say, all your labs are normal. We'll see you again in a year. And they're like, well, wait, what are these labs and what do they mean? So if they have questions about it, they can tag them and say, hey, I just need someone to explain my DEXA scan to me. Why does my mammogram, why do I have to come back in 3 months or 6 months? And so that's the nice thing about having it. And I think telemedicine is so easy. They get a Zoom link when they schedule and they could do it in their car. I've seen people in their closet with their children outside at the middle of the night because we have after hour times. I've seen them with their husbands because their husband's the one who dragged them there, and I'm like, well, I mean, good for you, but I think you have a secondary cause that why you want a benefit that you want them to be seen. But they're there, and so you have women who don't have transportation. We see people in rural America who have no access to a gynecologist for a year or 6 months. So we kind of get them in if they still should see their primary care for their pap smear and their breast exam. But now pap smears can be mailed in. I have a few patients who just can't make the 100-mile drive to go see. So we have mailed
Wow.
box to them that can self-collect, and that gives them some time until they can be seen. Medications are shipped to them or they can go to the local pharmacy. We do not like memberships. I'm membershiped out. I feel like I have a membership to everything. So we got rid of that. We just like, well, how do we make this easier? You pay for your visit and you call it a day. So that's how we have made it. So you have the most time to see us and listen, so we can listen to each other and have a conversation and not feel like, okay, I got to get my blood pressure, walk into a room and now wait on the paper table. I don't know. It takes all
Yeah.
that out.
Yeah. It's fantastic. It truly is. I have I told Jen to come find you. I told my wife to come find you. And so like you've got your support crew over here. It's just
Awesome.
and it's been such a gift. It really has. And I think we need more of you in the world to help us women who are going through this phase to be able to like have honest conversations, talk about the fears, talk and even talk like you were saying before about the burn book, right? Like that's something, this is a symptom Jen hasn't really experienced. But like that inner rage that comes as your hormones are shifting, like that's no joke.
No, it is totally there. And it's small things too, right? That used to not tick you off and now like, what? Why can I?
Yeah.
And you could feel it rising.
Yeah.
Hmm.
And being able to just name that and actually express it with somebody who's not going to look at you and be like, you need to calm down.
Don't be
Right?
so
Like,
emotional. Don't be
right?
so
Like,
Don't be
emotional.
so
Why are you so
emotional.
emotional?
Don't
yeah,
be hysterical.
Don't be
right.
like
Yeah.
you're hysterical. And the
It's
horse it
just
rode in on.
It's because I work right now also. I work at a place that serves all men. And so
Sorry.
I am the chief operating officer for this place that serves young men from ages 16 to 30, and they're all male clinicians. Such a strange world I live in right now. And so when they come in sometimes and they've these, I know I'm saying that out loud, but there's something else on the other side. Um, they come in and they said, yeah, this mom is she's just like kind of she's losing it. And I was like, whoa, whoa. Like I said, how old's her kid? How old is she? Oh, she's like 45, 48. I said, okay, can we have a moment here? And so I have to like explain all of the things that are going on for this mom and this woman, aside from the fact that she's raising a teenage boy who's struggling.
Yes.
Like, it just blows my mind.
But you know what? You're doing the best service for us is educating the men.
Yeah.
Right? The
Yeah.
more that men know about this, the more it opens the conversation, but for them to
Yeah.
support us in the right way, right?
Yeah.
Because we're seeing it across the board that I hope I teach my boys that when I lose my inner rage on them, that they understand that the future wife and the future daughters that they are going to be around, that
Yes.
they have to be this person to help fund our health. Women's health right now is poorly funded, but guess who
Yeah.
Mhm.
holds the purse strings? It's also men, and it
Yeah.
Yeah.
has long been. So we have to change their outlook on it. We have to change. We have to educate them. That's going to
Yeah.
be the biggest step. I sometimes.
Yeah.
You were
Absolutely.
talking before about your friends and the trip. Who's there for you? You show up for so many people all the time. Who do you feel like you've got in your corner who you can call at 2 a.m. or who's part of your support system that you want to shine a light on?
Oh, it's going to be definitely my business partner and my
Mm,
partner in all things professional is just Dr. Walsh. Teresa's my
mm.
co-founder, and we call each other in the middle of the night at 6 a.m. and we shoot our rage back and forth. Um, we're both moms. We're both working moms. We both do telemedicine in the same field. Um, and it's so nice to complain about our husbands in a safe place. Even though I
Mhm.
love my husband, he might listen to
Mm.
this podcast and, what have you done? You have just been guy bashed the whole time. And
No.
he's a unicorn husband. I love him, but there are certain things that you just can't say other to a girlfriend. That someone that
Yeah.
you're in the trenches with, and is going to get your back. I would say her. She sometimes like, you know what? Today I just can't stand you. So she used to whip out her Evamis and spray her arm, and she'd be like, "I need some estrogen right now," and I'm like, "Oh, shut up, shut up."
I
That's so
love it.
great.
I love it.
So, so that's
Are
fun.
there other organizations or other offices like yours in the country that you feel are doing good work? And then conversely, if you could wave a magic wand, what do you wish that you saw more of in telehealth, let's say, or there's some advice that you would want to give to either your professional compatriots or clients who would come and find you?
Yeah, so there are small, I say niche practices popping up everywhere. Sometimes they're brick and mortar, sometimes they're in telemedicine. Many OBGYNs who are just waking up to say this is something that needs to be accessible to women in my state. So they're sprouting up everywhere, which I applaud them every single day. I think telemedicine is one of those things that's people think, oh, it may not be real medicine, but
Mm.
the most of the stuff we do in brick and mortar is counseling. You can do that
Mm.
over a video. You're right. There is a component of physical exam, and a good physician's been working clinically for a long time, knows when the line is crossed, where you really need to be seen in person. And so I think telemedicine is sometimes even harder because you got to recognize those before you waste everybody's time and make sure you send them to the right people. If it's a business thing, though, I say that's the harder part, making sure they follow the state laws, build their, and you mentioned LLC and S corp. Those are so important to set up to protect yourself, your practice, and also your patients.
Mm.
Um, I love telemedicine. I believe it's going to be the new wave. It's very
Mm.
important because it's the only way to expeditiously increase access. I
Mm.
think access is going to slowly decline over the US, both because of a political changes and by payment. The insurances are just, they are not in the right place right now, as well as pharmaceutical companies. And they're making it much more expensive and harder to coordinate and work in this network of just, I want to say it's a clusterfuck, but it is. It
Yeah.
Yeah.
is.
Yeah.
Yeah.
I'm in it and I can't even navigate it. So that
Mhm.
just makes how hard it must be for as a patient, and our fellow physicians who are just trying to treat people. So I
Mhm.
always jokingly say that medicine is easy. It's all the other stuff that makes our job
Yeah.
really, really hard. So my advice for patients, though, is that making sure you find the right provider for you. And it's taken me a decade or more to understand that I can't be the physician for the same physician for everyone. I have my own style, and so I hope that you come and you get the care that you need. But sometimes people need different things, like the bedside manner. I have a friend who likes the bedside manner to be more patriarchal. That might be her generational difference, right? She
Yeah.
wants to be told what to do. She's like, what is this informed consent? I just want you to tell me what medicines I need to take and when I should take it. But that's a cultural difference. It's an age difference. And she finds the right physician for her. There are some who need to be seen in person. They just need someone to sit in front of them and touch them. That's totally what they should be finding. And then there's the third who says, I want everything done. I want it all. And I'm not always that. Sometimes I say, that's not going to be the right thing for you. But she's like, I want to try it anyways. And so there's physicians who are willing to do those things. So it's a kind of finding the right person that fits what you're looking for.
Yeah, absolutely. And that takes some time. It takes some time. You know,
Nice.
like I went through a couple different kind of telehealth companies until I found you. And it is kind of making sure it's the right fit for you. And to me, I think what's so important is the collaborative nature of it, being able to be in it together. And I think what you do so well is that you listen and you don't negate the patient's experience as irrelevant because we don't have as much knowledge about it, but like you take that in and you're kind of a co-pilot with us on this journey.
Yes, I love patients like you, both of you, who are like comes in armed and educated, and then they say, okay, these are the things I've tried, and I just want to know, can I do it better, or do I need to, what is it that,
Yeah.
and that's so nice to have the part, like you said, the partner.
Yeah.
I don't like telling patients what to do. It makes me feel uncomfortable, and also like the weight of the decisions on me. I want to be like, this is a collaborative effort because you have to tell me how you're feeling on it. It might
Yeah.
change, and it's okay to change. But that's every patient is very different. I will say that there are very large telemedicine companies right now who are drowning out the individual small. It's like big businesses, small businesses. They're doing the same things that you'd see in like large group practices, right? They're shortening the amount of time that you see patients. They're switching us out with non-menopause certified providers because it's cheaper. So you're going to see this new wave coming out. I say at the Walmart or Costco of menopause, and they do it. Their job is to make it more accessible and cheaper, but in return, you have to cut corners to make that cost. And I think those are starting to come out. We see a lot of patients from those services simply because they are hey, give everything, check all the boxes, make them happy because they are a consumer. And I see patients as patients. They're coming to me with a problem they need help with, and we got to make sure we have the right treatment or the right therapy and work with them for that.
Yeah, that's
What do
so
you,
important.
I'm sorry, Nick.
No,
I
go
didn't
ahead.
mean to talk over you. Dr. Kumar, what do you see for yourself and for the practice in the next 5 to 10 years? Is there something in particular that you are kind of excited about, or is there something that you are looking forward to doing or not doing as your practice grows?
Yes. We hope to add more people. We want people who are similar to us. That's hard to find the right partner. So expanding because we're getting a little busier. And so that's harder and harder to make sure. And we cap. That means that if I can't fit everybody in and I know there's going to be urgent visits, then I don't add any more new patients. So we need someone to bounce those two. We are focusing a lot more on vaginal and sexual health, which has been harder to navigate in the telemedicine world, but we are finding there are great solutions. But women who are so embarrassed that they can't, seeing someone in person can't happen for them, or they don't have a specialist nearby, we've created some new things and technologies where they can take pictures of their vagina and send it to me. And the screen that goes through, and then me looking at it can get pretty darn close at what this is and get them the right treatment without having them to drive to their
Wow.
closest OBGYN that's 100 miles away. We just started our urgent care because we had so many requests. Like, I have a UTI. My provider wants me to come in 48 hours, but I'm suffering now. Urgent care costs me $150. The wait is 3 hours.
Yes.
Yeah, I have these symptoms, and I'm like, I believe you. Here's your treatment. I don't need you. Here's your lab slip. If you really want, if you got tested for it, you want to test, here it is. You've had 3 UTIs in a month. By the way, it's just not antibiotics. It's this, so it's gotten so that I don't have to see them on video sometimes. It's just the chat box back and forth. And then I send the medication and it gets into their door by the next 2 hours. So that's ramping up over the next couple months.
Yeah, I feel like we need to have a part two. And because before I was going to ask you about the vagina. I was literally going to say, can we talk about the vagina and the labia? The labia is my favorite topic, of course. Like,
I
I
love the
just think,
labia.
yeah, the labia is just crazy changes in the labia during this time.
Mhm.
And I feel like that's a topic that, again, like people are becoming more comfortable talking about, but it's
Mhm.
still the conversation is just starting around sexual health, around the vagina, all things vagina. So I think we should absolutely have another like
Oh, for
conversation.
sure.
I love that.
Sex
I
is so
love that.
important. It is
Yeah.
important.
Yeah.
And the vagina needs to be spoken louder. My 9-year-old, or my 10-year-old knows the vulva. She says vulva, and the teacher had to write a note back. Well, so I appreciate that she's speaking of anatomical language, but she says vulva quite often.
Love
Hey,
I
that.
was
you know
like,
what? I'd
oh,
rather have her be comfortable with it than not, She's going to
yes,
be
yes,
she's going to be using all these parts for many, 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 many years, as we all
correct,
Right.
hopefully
right.
are.
Yeah.
Yes,
Right.
So, yeah,
exactly.
that's good
So
good on
so
you for getting her to
important.
use the right words.
Yeah. So as we
Adorable.
wrap up, there is a question we ask all of our guests on the show. So I would love to know, Dr. Kumar, what is the one food that you could eat every single day and not get tired of?
You know what it is? Matcha. It's not a food, it's a
Mm,
drink. But I
Oh,
have to have my matcha every day.
okay.
I have a little whisk. It's like a whole
Yeah.
ceremony.
oh
And
yes.
Yeah.
I make it, and it's just brings me a sense of peace. And I go to Japan because I'm close to the Japan, so I fly
Mm.
there and I hoard it. But I have my little containers, and it's just mine. My kids don't like the taste of it, so I'm not stealing it. My husband, he likes his coffee, and so it's just for me.
Mm,
I
I
love
love
Matcha.
that for
that.
you. I've been a matcha drinker for ages, and I have one special bowl that I use, and I have my whisk
Yes.
and my little, and it's just, if you had to plug a brand that you love, what's a brand that you can think of that you really enjoy?
Oh my gosh, I don't know. I just know the
Oh, it's
Japanese, I know
okay.
it by the container. But I go to this little subway store that's on the bottom of one of the main Tokyo subway central that's from the airport, and it
Mm.
sells all sorts of matcha. And I bring the empty container back to the man in case he's lost or doesn't know what it is, and I don't know what it is, and he just gets it for me, and I get 2 of them. They're like
I love
it's
it.
like a blue and white. I know that's not helpful at all. I need to take a
And that's
picture.
okay. No, but
Yeah.
it's just nice knowing that it's that personal for you. That's
It
beautiful. How
is what
many
it
hours
is.
does it take you to get to Japan from Hawaii?
Oh, it's like 6 hours. 6 hours.
Oh,
It's the
not
close.
bad.
It's
You
it's
kidding
so
me?
because it's far for you both.
Oh yeah.
Oh,
Oh yeah.
24? Is it close? It's
Yeah,
almost like
it's a
yeah.
long
Have you
time.
have you guys been to Japan?
I've been
Jen
once
Jen
back in
has.
2007, and it was one of the most magical places on the planet. I
You guys are
absolutely
both
loved it.
foodies. You should definitely go to Japan. The food since then is insane.
I
It's better
Really?
than it was in the last decade. They're perfectionist. Their culture loves
Yeah,
perfection in everything. So even if it's
yeah,
pizza, something that's
yeah.
not belongs to their, it is not culturally their food group, they have perfected it, and it's just amazing.
Oh. I love that. Maybe that's where
Maybe that's our
WTF should
friend.
go there.
That's our
Yes.
friendiversary. That's our
R-
our 30th friendiversary trip. Maybe that's what we should
You
do.
should
We'll go
bring
to
your burn
Tokyo.
journal and then
Yep.
write it
Yes.
off of your LLC.
Yeah.
That's
Yes.
right.
There we
I
go. Love the
I
way you
love that.
think, girl. That's perfect. That's
I love
I
it.
perfect.
highly recommend.
Thank you
Mm,
so much for taking the time and just in
seriously.
spending it with us. And I hope that we both hope that you'll come back for another
Yes,
episode and
please have
just
me.
About the
um
vulva.
about the vulva.
Yes, we'll do the vulva, sex toys,
Yep.
Yes.
All about
how
it.
sex changes for women, like oral sex. It's I just wish that women knew that oral sex is the best in their 40s, and they were like, we didn't even know that was a thing. And I'm like, yes, it is a
It's pretty
thing.
good in your 50s too, so far. So, I mean, I turned 51 in a week, and I can tell you, A-okay from over here in the Acton, Massachusetts.
Yes, Queen.
Just saying.
Yes.
Just saying.
That's right. That's right. It's the best. All right, ladies.
You're such a bright light. It's just such a pleasure. Thank you. Thank you. Thank
Thank you,
you.
you both. Oh my gosh, thanks for having me on. Hopefully you have me back.
Yeah,
Absolutely.
absolutely. Have a good rest of your day.
Take
You
good
too.
care. Bye.
Bye.
Well, that was delish. Thanks for pulling up a chair with us at Women Around a Table Eating Food. You can find us here bi-weekly, so if you loved today's conversation, hit follow wherever you listen to podcasts. You can also find us on YouTube or Instagram at Women Around a Table, and share it with a friend, because there's always room for more at our table.